Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dietary fats. Introduction. Dietary fat is a major source of energy. It also helps your body absorb vitamins. Fat is important for proper growth, development, and general health. Dietary fat also plays a major role in your cholesterol levels, but not all fats are the same. You should try to avoid saturated fats and trans fat. These unhealthy fats can be replaced with healthier, unsaturated fats. This program will help you understand the importance of dietary fats. It also explains how to make sure you are getting the right amount of fat in your diet. Dietary fats. Fats are nutrients that you get from eating food. Your body needs dietary fats to perform many important functions, but eating too much fat can also be harmful. All fats contain saturated and unsaturated fat. The label a fat receives depends on the type of fat that makes up the majority. Some fats are better for your health than others. To help prevent heart disease and stroke, most of the fats you eat should be unsaturated. The one exception is trans fat, an unhealthy type of unsaturated fat. Benefits of dietary fats. Getting the right amount of fat in your diet is important. Fat is essential to growth and development. Children need fat in their diet for their brains and nervous systems to develop correctly. Fats also help give your body the energy it needs to be active. Fats contain calories, which are a type of fuel for the body. If you do not get enough calories from the fats you eat, you may feel tired. Fats also help the body absorb important vitamins. Vitamins A, D, E, and K are fat-soluble vitamins. They can only be absorbed if there is fat in your diet. Fats are also the building blocks of hormones. Hormones are chemicals that act as messengers in the body. They transport a signal from one cell to another. The body also uses fats to insulate nervous system tissues in the body. The insulation helps the body send sensory information, like smell and taste, to the brain faster. Fat also helps you feel full. The result is that you are less likely to eat too much food. Fat is also important for skin and hair health, controlling inflammation, blood clotting.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Healthy fats. Unsaturated fats are healthier than saturated fats. Types of unsaturated fats include monounsaturated fats and polyunsaturated fats. A diet that is balanced and includes the recommended amounts of these fats can help prevent heart disease and stroke. Monounsaturated fats are found in most nuts. Other foods that are high in these fats include olive oil, peanut oil, canola oil, avocados. Polyunsaturated fats are found in certain types of oil, including safflower oil, corn oil, sunflower oil, soybean oil, cottonseed oil. Omega-3 fatty acids are a type of polyunsaturated fat that appears to reduce your risk of heart disease. Good sources of omega-3s are fatty fish, including salmon, trout, herring, mackerel, anchovies, sardines. You can also get omega-3s from plant sources. These include ground flax seeds, flaxseed oil, and walnuts. Small amounts are also found in soybean and canola oils. Less healthy fats. Saturated fats and trans fat are less healthy than unsaturated fats. These unhealthy fats can increase your risk of heart disease by causing the buildup of a fatty substance in your arteries. When fatty substances build up in your arteries, your heart does not get all the blood it needs to work properly. The result can be chest pain or a heart attack. These fats also increase your risk of stroke when fatty substances build up in the arteries carrying blood to your brain.
Foods high in saturated fats include red meat, such as beef, pork, or lamb, poultry, butter, cheese, whole milk and whole milk products, coconut oil, palm oil. Trans fat is an unhealthy type of unsaturated fat. Trans fat is made when hydrogen is added to vegetable oils to make them more solid and help them last longer. Animal products like meat and dairy naturally contain small amounts of trans fat. Trans fat is found in foods made with hydrogenated, hydrogen-added, and partially hydrogenated oils. Check the ingredients listed on the food package to see if the food contains these oils.
You are likely to find trans fat in commercial baked goods, such as crackers, cookies, and cakes. Trans fat is also found in fried foods, such as donuts and French fries. Stick or hard margarine and shortening are also high in trans fat.
Cholesterol is found in many animal products, including egg yolks, cheese, and red meat. Eating cholesterol may not affect the level of cholesterol in the blood very much. It affects some people more than others. Some people may need to limit how much they eat.
Although monounsaturated and polyunsaturated fats are better for your health than saturated fats and trans fat, eating large amounts of any fat can cause weight gain.
Eat healthy fats in moderation. Make sure you are getting enough nutrient-dense foods like fruits, vegetables, and whole grains in addition to healthy fats.
Recommended amounts.
Fat is a great source of energy. By weight, it has more than twice the calories as the same amount of carbohydrates or protein. 1 gram of fat provides 9 calories, but there are only 4 calories in 1 gram of either carbohydrates or protein.
Because fat is so rich in calories, you need to make sure you're not getting too much of it in your diet. Extra calories can be unhealthy if your body doesn't burn them through daily activities. To help you live a healthy lifestyle, healthcare providers recommend total fat limits based on your age. Your diet should not exceed a certain percentage of total calories from fat. In general, as you get older, you need fewer calories from fat.
For children ages 1 to 3 years old, healthcare providers recommend that 30 to 35% of total calories come from fat.
For children and young adults ages 4 to 18 years old, healthcare providers recommend that 25 to 35% of total calories come from fat. For adults ages 19 and older, healthcare providers recommend that 20 to 35% of total calories come from fat.
Healthcare providers also recommend that you consume less than 6% of calories from saturated fats. Replace solid fats with oils when possible. Limit foods that contain synthetic sources of trans fat, like hydrogenated oil. Keep total trans fat consumption as low as possible. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Fats are nutrients that you get from eating food. Your body needs dietary fat to perform many important functions. All fats contain saturated and unsaturated fat. The label a fat receives depends on the type of fat that makes up the majority.
Unsaturated fats are healthier than saturated fats and trans fat. These unhealthy fats can increase your risk of heart disease by causing the buildup of a fatty substance in your arteries. Types of unsaturated fats include monounsaturated fats and polyunsaturated fats. Although monounsaturated and polyunsaturated fats are better for your health than saturated fats and trans fat, eating large amounts of any fat can cause weight gain.
To help people live a healthy lifestyle, healthcare providers recommend total fat limits based on your age. Your diet should not exceed a certain percentage of total calories from fat. In general, as you get older, you need fewer calories from fat.
Eat healthy fats in moderation. Make sure you are getting enough nutrient-dense foods like fruits, vegetables, and whole grains in addition to healthy fats. Thank you for using Explain.